Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to be going over the mechanism of diabetes. So just as a recap, why don't we go over what happens in a healthy individual that has an increase in blood glucose. So when this individual has an increase in blood glucose, the pancreas gets activated to secrete insulin. So we get an increase in insulin from the pancreas. And this leads to a reduction in blood glucose. And that's because the blood glucose gets absorbed by the tissues and through the walls of the blood vessel. Okay, so we have a little diagram here, and each of these kind of red blobs is a cell of the blood vessel. And in blue, of course, is glucose labeled here, and the insulin receptors are in white. And so again, in a healthy individual, there will be a release of insulin from the pancreas when there's really high levels of glucose in the blood. And that insulin will bind to these insulin receptors, allowing for the glucose to go through the blood vessels and be utilized by the tissues. So this is in a healthy individual. So there are two different types of diabetes. So there's type 1 diabetes, and then there's also type 2 diabetes, And so we'll go through the mechanism of both of these types of diabetes. So in type 1 diabetes, you usually get it when you're a little bit younger. So you're either born with it or you have usually like an infection later in life, maybe in your 20s or 30s, and you develop type 1 diabetes. And this is usually autoimmune. And what this means is that your own immune system is attacking your pancreas. And what this means is that your pancreas actually no longer produces insulin. No insulin, or very little insulin, but usually there's almost no insulin. And so you can imagine in this case, if someone has type 1 diabetes and they have a lot of glucose in the blood, the pancreas is not producing any insulin. There's no insulin at all. And so the insulin receptors aren't activated. And although there's lots of glucose in the blood, these cells, the blood vessel cells and the tissues behind the blood vessel cells, aren't going to get any of this glucose. And what actually ends up happening is the cells actually begin to die. Cell death. So this is if someone with type 1 diabetes doesn't take any insulin shots. There's cell death behind the blood vessels. And even though there's lots of glucose here, it just can't get to these cells. And so these cells, basically, you can think of it as starving to death. They starve to death. So for cells, glucose is their energy, and so if they don't get any of this glucose because there's no insulin, they'll actually starve to death. And so a lot of the symptoms of type 1 diabetes and even type 2 diabetes is associated or is caused by this cell death or these starved cells. Again, even though there's glucose available to them, the insulin isn't there to provide the glucose to them. So things like limb loss, right? So people with type 1 diabetes or type 2 diabetes, if they don't take their insulin, they can lose a limb, and that's kind of the worst case or the most severe case of this cell death. They also have issues with eyesight. So this is called retinopathy. So this is a problem with their eyes. And again, it's the same issue here. The eyes are basically just starving to death. You can also get neuropathy. So this is the same thing as with the eyes, only it's happening to neurons. So to your brain or to your neurons that allow you to move. So you can get neuropathy. And then the last side effect is actually cardiovascular disease. Cardiovascular disease. And the cardiovascular disease is actually not caused by cell starvation, but it's caused by this really high concentration of glucose in the blood vessels. And glucose is actually quite a damaging molecule, and we'll talk about glucose tests in another video, but these glucose molecules are very reactive. They like to bind to stuff. You can think of them as being like glue, and so they'll actually bind to stuff on the cell walls, and this causes damage to your blood vessels. And so your blood vessels actually become quite damaged and you get cardiovascular disease. So this is another side effect of type 1 and type 2 diabetes. So unlike type 1 diabetes, type 2 diabetes is usually onset older in life. And unlike type 1 diabetes that's autoimmune, this has nothing to do with your immune system. And you still produce insulin, but it's insulin resistance. Insulin resistance. And what this means is that your pancreas is still producing lots of insulin, but your body isn't responding to that insulin. And so you can think of this as your blood vessels having less receptors present. So they don't have as many receptors present. And so even if you produce lots of insulin, your vessels, your cells aren't responding to that insulin as much because there's just less receptors available. So in this example, in type 2 diabetes, there'll be lots of insulin produced, and actually studies show that in type 2 diabetes, usually people have higher levels of insulin in their blood than healthy individuals. So even though they're not responding to the insulin, they actually have higher concentrations. And again, this is likely because there are less receptors available. And so less glucose can actually make it through than in a healthy individual. And so you get a lot of the same effects as type 1 diabetes if you don't take your insulin. So you get cell death as well. And so that causes all of the same problems as here. And you also get cardiovascular disease because glucose is still too high concentration within your blood itself. So the treatment for type 1 diabetes is, of course, giving insulin. So insulin injections. So this is the treatment for type 1 diabetes. For type 2 diabetes, there's of course insulin injections as well, but lifestyle modifications can help quite a bit. Lifestyle modifications. So this includes exercise and diet. And so you can imagine that these cells are getting resistant to insulin. And so they're producing less receptors because the body always has a lot of insulin floating around. The blood glucose levels are always so high that your body always has insulin floating around. And so these cells start making less and less receptors. And so you can imagine if you stop having so much sugar, so from your diet, you stop having as much sugar, so less sugar. Your body stops having so much glucose in the blood, less influxes or less high levels of insulin, and your cells will start producing these insulin receptors more often, and you can actually recover some of this insulin resistance. So you can actually kind of gain back these receptors if you stop eating so much sugar. So diet can be really effective for type 2 diabetes. Exercise does something similar, so you use up your glucose a lot more and you get more receptors being expressed as well. And then of course you can also treat with insulin injections. But they've actually found that insulin injections also cause some issues. And you can imagine type 2 diabetes is insulin resistance because your body always has such high levels of insulin. So usually if you give insulin injections over time with type 2 diabetes, you have to give more and more insulin as their diabetes progresses, and your body becomes more and more resistant to it. So insulin injections is a really effective treatment, but really you want to focus on diet and exercise to improve kind of the underlying issue, and insulin injections really just help treat the symptoms. So the last thing that I wanted to touch on was gestational diabetes. And gestational diabetes is just diabetes that you develop during pregnancy, and it has the same mechanism as type 2 diabetes. So it's not that your body isn't producing insulin, it's that your body is becoming insulin resistant during pregnancy. And so the treatments for gestational diabetes are the same. You want to treat with lifestyle modifications, and then if that doesn't work, you want to treat with insulin injections as well.